Everybody, let me introduce myself. My name is Veronika Sally A. I'm from chemistry education. I will discuss about COVID-19 or coronavirus disease. My discussion will be divided by three main parts. The first one is what is about coronavirus or COVID-19. The second one is the data about how highly COVID-19 will be infect people, and the last one is how to prevent it from COVID-19. So I will discuss about the first part. What is coronavirus? Coronavirus disease, or as we know is COVID-19, is infection disease caused by SARS-CoV-2, a type of coronavirus. People with COVID-19 can experience fever, dry cough, and difficulty breathing. Sore throats, colds, or sneezing are less common. In the most vulnerable sufferers, this disease can lead to pneumonia and multi-organ failure. The infection spread from one person to another through splash from respiratory tract that often results when coughing or sneezing. The time from viral exposure to the onset of clinical symptoms ranges from 1 to 14 days, within an average of 5 days. The standard method of diagnosis is the back transcription polymerase chain reaction test from nasopharyngeal swabs or sputum samples, with the result within a few hours to 2 days. Antibody tests from blood serum samples can also be used with result within a few days. The second part, according from COVID-19 statistics, there are groups are vulnerable if they are infected by coronavirus, such as the age group of 80, with the mortality rate increasing by around 50%, compare the death rate of patients of age 30 to 39 years, which only 0.2%. This is an increase of more than 70 times. COVID-19 infection is also potentially more severe if it is suffered by patients who have cancer, chronic respiration disease, high blood pressure, diabetes, and cardiovascular disease. This group experienced a death rate of about 6 to 10 times greater than the mortality rate of patients without the same condition, which amount to around 0 to 9%. It should be underlined that suffering from this disease doesn't mean you are more vulnerable to contracting COVID-19. It's just that if the person of disease is infected with COVID-19, the disease will make the clinical symptoms of COVID-19 is worse. The last part is how to prevent COVID-19. Preventive measures to reduce the possibility of infection included staying at home, avoiding traveling and doing activities in public places, frequently washing hands with soap and water for a minimum of 20 seconds, not touching eyes, nose, and mouth with unwashed hands, and practicing hygiene, good breathing. The CDC recommends covering mouth and nose with a tissue when coughing or sneezing, and using the inside of elbow if no tissue is available. They are also recommended proper hand hygiene after coughing or sneezing. Physical limitation strategies necessary to reduce contact between infected people and large crowds, such as by closing schools and offices, limiting travel, and canceling large number of mass meetings. Behavioral physical restriction also include keeping a distance from others 6 feet, about 1.8 meters. So the conclusion my discussion is because the vaccine of SARS-CoV-2 is only available as early as 2021, the important thing is dealing the coronavirus disease pandemic is to suppress the rate spread of the virus, or what is known as epidemic curve. This can reduce the risk of being overwhelmed by medical staff in the face of the surge in patients, allowing better care for sufferers and giving additional time for drugs and vaccines to be available and ready to use. Therefore, keep cleanliness and do distance with other people to prevent the transmission. This is the end of my discussion. I hope this will be good for other people too. Goodbye.